Okay?
Okay, absolutely.
Understand
so I
that,
heard
I keep on telling you this. Here, take.
Yep. So what are you talking about then?
It's Lyrica, right? It's the Lyrica. It is the Lyrica. It is Lyrica.
Okay, so it's Lyrica. Okay. So, being specific then, we're not talking about opioids, that's correct?
No, absolutely not. We haven't been talking about anything to do with opioids since we started this conversation. The first 3 times. We don't need anything done with that. What we're talking about is his Lyrica.
Okay.
Okay?
So, okay. Well, see if I can hear you swearing in the background, but start talking if I hear profanity.
Listen.
Ma'am?
I'm going to go outside.
Profanity is
I have asked him to stop. I understand that.
Okay, I appreciate it.
Okay?
I appreciate it. Yep.
This is very frustrating for him, and I understand you're trying to help, but it feels as though, okay, I'm talking about my feelings right now. I'm feeling as though, okay, there's something going on where everybody is already raised in arms and is already in defense mechanism or defense mode when it comes to talking with my husband, to include yourself, okay? So, I know when we spoke to you 2 times ago that we have brought up the fact that he needs...
Mrs. Min, I'm going to tell you right now, we're going to reframe, okay, please. So, let's be behaviorally specific and work well when we have an agenda. We're in limit-setting land. I will respond very well to feelings. Okay, so can we back down to feelings, please?
Well, I thought I was doing feelings.
Nope. So when we bring up everybody's defensive, everybody's against, I certainly understand that, and that is in fact inaccurate. We're only trying to help. Okay?
Okay, but these are my feelings, and I'm expressing my feelings.
And I got that. So what we would do is, here's what we need to do to reframe. Also, we'll need some assurances. So he can monitor, right?
He is here.
Okay, I appreciate that. So as we reframe, can you please use I statements on behalf of...
I'm sorry, say that one more time?
Yeah, so on behalf of your husband, who is, and I appreciate that you're recording, we do need to make sure that...
He is. Yes.
And then as we're conversing, we can use I statements. Would that be reasonable? On behalf of, or we or I. Is that reasonable? We feel...
Okay, I thought I was doing that.
So your voice and tone, and Steve swearing in the background, I'm direct, okay? I'm fearful for your safety. I'm fearful for safety. I have a low threshold with these kind of things. So profanity in the background, small children in the house potentially.
None of the kids are here.
Awesome. Okay, so I'm fearful for your safety.
Why are you fearful for my safety?
When I hear profanity and a shouting individual in any kind of a conversation, we're past healthcare, we're into safety. So, for assurances, we're having a reasonable conversation. I respect this man in service connections, and all he's done for the country. We deeply respect and honor the service. So we'd like to have a civil conversation using I statements. And if you have specific questions about specific medication, we can have it, please. So does that sound reasonable?
Okay, I thought we were, and I'm trying to communicate our needs to you.
Cool.
Okay.
So does that sound reasonable, Mrs. Moore?
And I already agreed to that.
Okay, I didn't hear you say that. I apologize.
So, I understand your desire to control the conversation. That's what you're supposed to do. But if I can now speak on what our needs are for my husband, I would be grateful for that opportunity without being interrupted.
And I want to make sure we have good ground rules. And you can tell me, do you have any other ground rules you'd like, Mrs. Mayor?
For right now, I don't think that... All I want to do is be able to communicate with you what our needs are.
Absolutely.
So that we can get them addressed, because it's something that needs to be addressed quickly.
Okay. What do you got on? Yes, ma'am. Absolutely. That's much more reasonable.
So, this has nothing to do with opioid treatment, and it has nothing to do with his outside care treatment with the civilian side of the house. This has to do with the VA prescribing his other medications. The one that is important is the Lyrica.
Okay, very reasonable.
Okay, I don't know if you know anything about Lyrica, but if you stop that cold turkey, it has catastrophic effects on your health. And he's already done this twice, and it is absolutely horrible. It almost completely incapacitates him. So I and my husband need to know who is going to be doing the prescribing, because the pain clinic pushed it down to his primary care. His primary care does not want to do it and put in another referral to the pain clinic for it to happen.
So who was your last prescriber for Lyrica?
The pain clinic. Pain
The
pharmacist?
pain clinic?
Who? Oh, Leo was supposed to do it. So before Leo, it was who?
Told him he would have to take it over and do it.
Okay, so that's what I thought I said. The pain clinic gave it to Leo, Dr. Leo, said that he had to do it, but he doesn't want to do it, and he pushed it back to the pain clinic.
Okay. Well, hang on there just a minute.
When was the last time he got a prescription?
Yes.
I sent the email to Monique.
He sent an email to Monique with that information in it.
Yeah, no, the emails, because that's what they
Secure message. I'm sorry. Secure message. To me, they're both the same.
Yeah. Right. And so that's where things can get really confusing. So can you guys secure message to... So who is the last prescriber of the record? Was it Leo?
Leo.
Okay. How many pills do you have left?
Say that again. For some reason, you're coming across
I
very muffled.
apologize. That's because I'm not looking at the phone. How many pills do you have left for the Lyrica?
Half a month.
Ma'am?
I am. Did you hear me? I said a half a month.
Oh, half a month? Okay, so it's not quite emergent.
I think he goes to the 27th.
Yeah, so you've got... So if you go to the two options for you with that and just that specific issue, you've got, I believe, you're going to see Dr. Leo on the 22nd face-to-face, right? Because I've got your appointment here. I checked before we got on the phone. So I've got you with Leo, Dr. Leo, January 22nd.
Correct, but he does not want to prescribe this medication.
Okay. So remember, and I'm not arguing with him, just giving you facts. So Dr. Leo is the quarterback. So he is the one that negotiates, not the negotiator. He's the quarterback. So he's the one you have to talk with to say kind of yay or nay with that. So we can't tell a doctor what to prescribe or not to prescribe.
We have spoke to him about that, and he said he submitted a referral back to the pain clinic to do the prescribing.
The pain, and so here, and I'm just direct with you, and I understand your frustration with the loops. I totally get what you're saying. The pain clinic is no longer involved with the man in care. They are not involved.
When did that take place?
So I don't have a date for you. The next time we talk, I'll find out. Care has been sent to the Toledo Pain Clinic. So I understand what your frustration is.
The Toledo Pain Clinic?
Well, whoever you're at the care in the community. So the pain clinic is not...
So the community care provider is the one who's taking over his whole body treatment for pain.
So all I can tell you is, right now, the facts that I have, and I'm parsing through it with Monique, so for this piece of what we're talking about, is the pain clinic is, I think I understand what's going on now. The pain clinic is not involved in this.
In notes, it says from the pain clinic that they responded to Leo's request. They were going to take it on.